Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What's new with Holy Cross Hospital Health? Find out right now. My guest this evening is Dr. Blair Eig, Chief Medical Officer of Holy Cross Hospital Health. Dr. Eig, welcome to Housecall.
Thank you, David.
In any case, tell our viewers briefly about your professional background and how you went on to join Holy Cross.
Well, I'm a native of Montgomery County, born and raised here. Went away to get my medical training. I went to Harvard Medical School, but came back to do my residency in pediatrics at Children's Hospital in Washington. I was chief resident there for a year, and then went into practice in Silver Spring and, of course, at Holy Cross Hospital. In practice for 14 years, when the position for chief medical officer at the hospital opened up, and I had an interest, and they had an interest in me, and I've been the chief medical officer for the last 16 years at Holy Cross Hospital, and now Holy Cross Health, which also includes Holy Cross Germantown Hospital and our health network.
Very nice, very nice. Do you miss private practice at all?
I do. The most fun was, as a pediatrician, was the kids and the families.
Sure.
Sitting on the floor. I can't do that anymore in the hospital. I don't miss the night call that much.
Yeah, I don't blame you. So, briefly, tell our viewers about the wonderful history of Holy Cross Hospital, beginning with the first hospital in Silver Spring.
Sure. The Silver Spring community wanted a hospital very badly, and in the 1940s and 1950s really tried very hard to get the business community and others involved in building a hospital in Silver Spring. Fortunately for the business community, the Sisters of the Holy Cross wanted the same thing. The two came together, and the hospital was created. It was opened in January of 1963, and was a big boon to the community, both in terms of serving the community for its health needs, but also economically providing a lot of occupations and professions for people in the Silver Spring community. My family's had a long history with the hospital. I'm very proud to be part of that. My father was the first chairman of the Department of Medicine when the hospital opened in 1963. Wow. A lot younger than I am now. Yeah. And later on was president of the medical staff in the late 1960s.
Very nice. So a real family tradition.
It is. I've also had a brother and a sister-in-law on staff there.
Very nice. So the original Holy Cross Hospital, how many beds did it have?
It started out with less than 100 beds, and not all 8 floors were open when the hospital first opened, but that rapidly changed over the years, and certainly in the first couple of years it grew, expanded, and obviously became very, very popular for the community, not having to go downtown to get their health care. The growth of the hospital was sort of by decade. In the 1970s, it expanded with more patient floors, a new emergency room, new operating rooms. In the 1980s, we added on a larger labor and delivery unit, more laboratory and cafeteria space. The big changes came when we got our just recently retired CEO, Kevin Sexton, in 1998. When Kevin came, he saw a lot of opportunity to work with the community to expand our services by expanding the hospital. The first big expansion was between 2000 and 2005. We added on more floor space, a new education center, a new concourse, a bigger emergency room to meet people's needs, a surgical intensive care unit, and an office building, all done during that time. That was very successful, again, for the hospital, but more importantly, to meet what the community needed for their health care. Sure. The most recent expansion was towards the end of Kevin Sexton's leadership for us, was the new bed tower that sits right on the Beltway. People who drive by the Beltway can probably see it near the Georgia Avenue exit. It's a 7-story building that got us to all private rooms. We have 450 beds in the hospital and all our private rooms now.
Remarkable. Absolutely. And the best part is you got rid of that chimney.
Well, some of us remember that chimney from our childhood. It was a special landmark when the Beltway, which opened up a year after Holy Cross.
Right.
I kind of remember that.
Yeah.
The construction crew was very nice. When they took it down, they gave me a piece of it so that I could display that in my office.
There you go. There you go. You mentioned some of the exciting expansions incrementally over the years. Focusing now on Holy Cross Hospital, Silver Spring, what are some of the strengths you think it brings to the community in terms of quality clinical care?
I think what's important to know is that Holy Cross Hospital is a full-service acute care hospital. So we have the second largest emergency room in the state of Maryland.
Remarkable.
With over 90,000 visits a year because, again, the community needs us when they need us. We have the largest maternity center in the state of Maryland and, in fact, in the entire region.
Wow.
We deliver over 9,000 babies a year at Holy Cross Hospital in Silver Spring. And that's more than one baby an hour. It's a busy place, but we have staff there, just an incredibly trained and experienced staff. Our nursing staff is wonderful. And we have obstetricians, anesthesiologists, and neonatologists, newborn specialists there 24 hours a day to meet those needs. There's not an hour that goes by. We don't have those doctors on the labor and delivery floor ready to deliver those babies. We have 17 operating rooms ready and available to do surgeries. So a lot of surgery going on and all kinds, general surgery, both thoracic and breast surgery, and a lot of gynecologic surgery. Because of our maternity services, a lot of women trust Holy Cross for care and come back when they have a need for their GYN or their GYN cancer surgery. We also have, just in terms of general medical services, several floors devoted to senior care. We recognized many years ago that the population is aging and that seniors use the hospital 5 times as much as people under 65. Because of that, we knew that we need to be prepared for the baby boomers. That's you and me, David.
Yes.
Coming through the senior group over the next 25 years.
Yeah.
So we expanded our senior services with special training for nurses and doctors, with the first seniors emergency center in the country.
Remarkable.
Which we opened over 10 years ago. It's the first one. It's been copied many times now. But with a recognition that seniors have different needs, some special needs, more time, better lighting, thicker mattresses on the beds and on the stretchers that they're on, so they don't get pressure ulcers, for example. We have blanket warmers. We have specially trained nurses, I mentioned, but also social workers who help them with, again, placement issues or care issues that they might need at home. We want to make sure we provide, the best care to seniors because that's going to be us, and we want, the community to be taken care of the way we would want to be taken care of.
Given the history of the Sisters of Holy Cross, share with our viewers what you've done historically over the years for uninsured patients.
It's in our mission, and it certainly was handed down to us from the sisters in a faith-based institution that we take care of people in need. Those are our most precious citizens. And we understand that there are a lot of people out there who don't have the means, whether it's insurance, they may be out of work, they may be don't have the resources others do, that we need to reach out to them to take care of them. Certainly we see them when they come to the emergency room or get other services at the hospital, but we've established 4 community care clinics in the county, each seeing 10,000 patient visits a year. So it's 40,000 visits in our community to our local population that don't have insurance.
Yeah.
There we have one in Silver Spring, one in Aspen Hill, one in Gaithersburg, and one in Germantown.
Remarkable.
And the idea that we felt was that we needed to provide care to those most in need. It's what the sisters will want us to do. It's what we do to take care of our community.
And you also have a liaison, I believe, with the Asbury Methodist senior citizen community. Tell us about that.
There's a clinic at Asbury Methodist Village that has both primary care and geriatric care, of course, for the seniors who live there, but also some specialty care, and we run that clinic now. So we have a geriatrician who practices there during the week, and some specialties that come in, like cardiology, to take care of special patient needs out there. We work well with the community out there. It's convenience both to the residents of Asbury Methodist Village, but other patients from the community can visit and use those facilities, if there's time on the schedule, to be able to use the geriatrician and the other specialists who go there. It's a wonderful partnership, and I think an important one to be able to take care again of seniors in their community and not have them have to travel far for their care.
What about psychiatry?
We have a behavioral health unit in our new hospital out in Germantown. So we'll talk about that in a few minutes about Germantown.
And Holy Cross?
We don't have an inpatient unit in Silver Spring, but we work well with those units around the state because we'll get patients in the hospital, either in the emergency room or on the patient floors who need behavioral health services. We have a liaison behavioral health service with a psychiatrist and psychologists and psychiatric social workers who see all those patients and care for them while they're at Holy Cross. And most importantly, we find appropriate placement for them if they need inpatient care at a psychiatric unit elsewhere in the state.
You mentioned social workers several times during your prior comments. Explain to our viewers how important the social worker team is for transitioning care upon discharge. What are some of the services they will look into?
I think everybody knows healthcare has gotten very complicated. And to be able to navigate through that, both with your primary care physician, your specialists, your hospital-based physicians and other care teams, and then if you go to the hospital, having to go back into the community, whether you live at home or in some retirement facility, for example, or nursing home, you need somebody who understands the system, can communicate with all those members of the healthcare team, and perhaps your insurance company and anybody else who might have an interest in what you're doing with your healthcare. The social worker does a lot of that work for the patient. They really are a connector. They really care about what's going to happen to the patient and making sure that they have the easiest time getting through the hospital and getting their needs met, and then after the hospital, because we don't want people having to get home not having the medicines they need, the care they need, even the meals that they might need, and have to come back to the hospital. Getting readmitted to the hospital is not fun and nobody wants it. So we want to make sure that they are cared for while they're at the hospital, but especially after they go home.
And you also assist, if necessary, with going to rehab centers or for a senior citizen, if necessary, a senior citizen home.
Yes, we try our best to keep in contact on a daily basis with all of the facilities outside of the hospital where our patients will end up, whether it's a rehab facility, a nursing facility of some kind, or a nursing home. We know that they need the best communication on what we've done so they can take the best care of the patient after we've discharged them. It's really important. I should say one of the most important things to us nowadays is to try to keep people healthy enough out in the community so they never have to come into the hospital. We run a number of community health programs, both educational programs, but also fitness programs, trying to keep seniors healthier.
If I can interject, I'll hold the thought. I want to hear all about it, but we're going to pause for a moment. We have a public service announcement. We'll be back in a moment with my special guest, Dr. Blair Eig, Medical Director of Holy Cross Hospital Health. We'll be right back.
A single ember from a wildfire can travel over a mile. You can't control where it will land, only what happens before it does. Visit fireadapted.org to learn how to protect your community from wildfires.
We're back. My guest this evening is Dr. Blair Eig, Chief Medical Officer of Holy Cross Hospital Health. Dr. Eig, when we paused for the break, we were discussing Holy Cross Health Community Services. Amplify that for us.
We provide a lot of both educational and activity programs out in our community through all of Montgomery and Prince George's County. We're very proud of that because it keeps our community healthier. And nowadays, it's important to try to keep healthier and stay out of the hospital. One of our most important programs is Senior Fit, where we get people over 65 up and moving around. dance classes, movement classes, stretching, balance, and in fact, weight training. And we've got people in their 80s and early 90s weight training out there.
Wonderful.
And it does keep them healthier. We've also started a Kids Fit program to try to bring it to the younger age population.
Very good. Several times during our dialogue, we talked about Holy Cross Health as opposed to Holy Cross Hospital. Explain to our viewers what exactly is Holy Cross Health and its mission.
So Holy Cross Health's mission is actually fairly simple and I think, to me, profound. We want to be the most trusted provider of healthcare to our community. And that's the way we've always been. That's what the sisters gave us when they started Holy Cross Hospital back in 1963. Holy Cross Health grew out of going from a single hospital to 2 hospitals and a health network. So Holy Cross Health is made up of Holy Cross Hospital, the hospital in Silver Spring, Holy Cross Germantown Hospital, our new hospital in Germantown, and the Holy Cross Health Network, which is our outpatient community clinics, as we've talked about already, the community health programs that we provide, and a lot of our relationship with community practitioners, specialists, and primary care practitioners in our community, because patients don't just stay at the hospital. They do go back out into the community, and as I said, one of our most important missions going forward is to keep them out of the hospital.
Yes. So you mentioned Holy Cross Hospital Germantown, which opened just a couple of years ago. Why a second hospital when Holy Cross Silver Spring has been doing so well?
Well, we are very proud of how Holy Cross Hospital in Silver Spring has done. Well, we recognize that that Montgomery County had grown in population significantly since the last hospital opened in 1979. In fact, almost 500,000 more residents in the county, and much of them in the upper half of the county, the northern half north of Gaithersburg. So it's an understanding that there was a need in the community for health care in the northern part of Montgomery County. We searched for a partner and found a wonderfully willing one in Montgomery College. Montgomery College was looking for to expand on their research and technology center in the campus in Germantown, and we were the right kind of partner for them. So we got state approval and built the first hospital on a community college campus in the country, as far as we know, and opened on October 1st, 2014, so just 2.5 years ago.
Yeah.
It's been a wonderful experience for many of us who've been involved with Holy Cross over the years to get to start a new hospital. I got to start a new medical staff, and to bring services to an area of the Washington, D.C. suburbs that didn't have those services before. So Holy Cross Germantown Hospital is a full acute care service hospital, has emergency room, has operating rooms, labor and delivery floor, not as big as in Silver Spring, but one day, who knows, and certainly medicine units just like in Silver Spring. One thing that we have there that we don't have, as we mentioned before, is a behavioral health unit where we can take care of patients with behavioral health problems. It's a voluntary unit, so the patients have to want to be there. But it does help out when people are in crisis, they have a place to go.
So to some extent, the two Holy Cross hospitals complement each other.
We recognize that specialty services did not need to be at both hospitals if we could take care of them at one hospital and not necessarily at the other. So behavioral health at Holy Cross Germantown, some of our more advanced neurosurgery and higher-end neonatal care in Silver Spring.
Okay.
So we don't do brain surgery in Germantown, we do it in Silver Spring. And newborns, especially premature newborns who are very sick, are taken care of in Silver Spring, not in Germantown. And if we have those problems come into the emergency room in Germantown, we can then transport down to Silver Spring. The same thing with a behavioral health patient in Silver Spring can be brought out to Germantown. And that way we can take care again of our community by having appropriate resources at both hospitals.
You'd mentioned this special mutually beneficial relationship with Montgomery College. Expand on what that means in terms of nursing services.
We recognize that there's not enough nurses to take care of those of us who are becoming seniors in the baby boomer population over the next 25 years, and that training nurses is a vital component to deliver health care. Montgomery College has always been a wonderful location for nurse training and medical technician training. Most of that has been down in the Silver Spring campus, but with the advent of Holy Cross Germantown Hospital on the campus in Germantown, they've built a new health sciences training center at Montgomery College in Germantown, and we are now training nurses and medical technicians at both of our hospitals so that we can provide for the future healthcare needs of all of Montgomery County and all of the Washington region. We think this is a great way to partner for education and give back to the community.
But what a remarkable synergy, and I know you realize this when you consider that you have nursing students at Montgomery College, and then right next door is Holy Cross Germantown, where they get to apply what they're learning in the classroom right next door.
Absolutely,
yeah. Absolutely.
And we're happy to be able to provide the opportunity for work for them after
yes.
they graduate.
Right.
For example, we had a radiology technician school at Holy Cross Hospital in Silver Spring for many years, but in partnership with Montgomery College in Germantown, we were able to move that training to Montgomery College now, so that again the training can happen at a community college, but the hands-on training and the future work can happen at the hospital next door.
Remarkable. As you know, an important part of the broad mission of any hospital, including Holy Cross, is education, continuing medical education for our physician colleagues, and then community education for the public. Share with our viewers some of the things you're doing there.
We have broad education at the hospital. You mentioned the community education. We talked about the classes we provide in community centers, senior centers, churches, synagogues, all across our region. Trying to get people healthy and keep them healthy. In terms of medical education, we have resident doctors.
Doctors in training.
Doctors in training.
Yeah.
From George Washington University, Howard University, and Walter Reed National Military Medical Center come through Holy Cross Hospital Silver Spring and now through Holy Cross Hospital at Holy Cross Germantown Hospital, and training in things like obstetrics. We got a lot of babies. Yeah. This is a great training for them. Surgery, and specialties like ear, nose, and throat, and neurosurgery. We have had a large program in pediatrics with Children's Hospital. In fact, I trained at Children's Hospital and a long time ago rotated as a doctor in training out at Holy Cross Hospital. So it's a long-standing relationship, and I think a wonderful one to train the physicians and also try to keep those physicians in training in our community so they can provide health care going forward for the next 25 years. We also do a lot, obviously, of nursing education, and the continuing medical education for physicians out in practice. We provide at our hospitals, and a broad range of programs, including the weekly grand rounds, lecture presentations, and a lot of conferences related to specialty care, which we think are very important to keep our community physicians up to date in the most modern care given.
Excellent. As you know, there are models that hospitals around the country follow economically to just run the hospital. And there's something unique about having a hospital in Maryland compared to any other state in the country. Explain to our viewers that unique model.
So Holy Cross Hospital is part of the Trinity Health System. It's a national health system run out of Michigan, a faith-based system, of course. And they know we're from Maryland when they ask us questions about how we run our hospital, and we tell them that Maryland is different.
Yes.
And Maryland is different than the 49 other states in the way hospitals are reimbursed, are paid. Starting over 30 years ago, Maryland went to what is called a rate-setting system, where a state board regulated the rates that hospitals were paid for patient care. Depending upon the patient care that's delivered, the seriousness of it, the length of stay perhaps, the rates would be adjusted. But that was still a regulated system that didn't occur in any other state. 3 years ago, that changed to become I guess you could say, more regulated. It went from what essentially was a regulated but still fee-for-service, that is, more patients, you were paid more, to a budgetary system where all of the hospitals in the state are on a budget. That budget is adjusted year over year due to inflation and maybe population growth if the population is growing. But you don't get more money for more volume or less money for less volume. So the hospitals have to manage within a budget which helps control healthcare costs, which we know are significant in this country, but makes it a lot more difficult for the hospitals in the state to manage because it's very different than what we were used to. Most of the hospitals are doing quite well. So the good news is we've saved the state a lot of money. What we hadn't figured out, and the state is working on now, is if there are population shifts within the state, or perhaps patients choose to go from one hospital to another for whatever the services are different, there's something they want there, how that money will follow the patients from one hospital to the next. That's the state is working on now, as long as there is a global cap or a global budget for the entire state so that healthcare costs are controlled and are not being raised faster than inflation, we will deem this successful in terms of controlling healthcare costs in hospitals. However, we do have some of the kinks to work out in the system.
We only have 1 minute left, but very briefly, what has been the position of Holy Cross Hospital vis-a-vis the Affordable Care Act, also called Obamacare, and Republican proposals to repeal and replace it?
We've been very supportive of the Affordable Care Act. We have seen in our market area patients get insurance that didn't have insurance before. That's good for everybody. They can get preventative care, they can avoid the emergency room for their care, and they can pay their hospital bills. That makes everybody happy. So we don't want to see it go away. We know there are some tweaks, that we know that it needs to be fixed in terms of the insurance markets. We understand that. But we're very happy with it, and we'd like to see it maintained.
So you like to see it tweaked, not repeal and replace it?
Yes, sir.
Dr. Eig, thank you for joining us on Housecall.
Thank you very much, Dr. Dolan.
My thanks to Dr. Blair Eig. My thanks to my terrific team here at the station. And most important, thanks to you, the viewer, for making Housecall the success it has become. We are now on prime time, 5 nights a week. Let me know how we're doing. You can reach me at our station website, mmctv.org. We are open to your suggestions for future topics. You can also reach me at my practice website, montgomerygastro.com. As for our next show, it's going to be a very important one. Jason Ware, representing the Home Hospice Society of Montgomery County, will be discussing home hospice. Look forward to seeing you then, next time, for another edition of Housecall. Good evening.